Hi viewer and welcome back to our channel. In today's video we will tell you about the diagnosis and treatment of mononucleosis. So before starting, please like this video and subscribe to our channel for updates. Infectious mononucleosis, also called mono, is a contagious disease. It is caused by Epstein-Barr-Virus, a member of the Herpes-virus family. It is common among teenagers and young adults, especially college students, and oftentimes referred to as kissing disease, as it is transmitted via saliva. At least 1 out of 4 teenagers and young adults who get infected with ABV will develop infectious mononucleosis. Your doctor may suspect mononucleosis based on your signs and symptoms, how long they've lasted, and a physical exam. He or she will look for signs such as swollen lymph nodes, tonsils, liver or spleen, and consider how these signs relate to the symptoms you describe. How does your doctor diagnose the disease? Your doctor will do what is called a blood count. In a blood count, the amount of different blood cells, for example red blood cells, white blood cells and platelets, is counted. In infectious mononucleosis, an elevated number of lymphocytes, a special kind of white blood cells, is found, and these cells are oftentimes abnormal looking. These blood tests won't confirm mononucleosis, but they may suggest it as a possibility. Also, your doctor can do an antibody test. There are different antibodies that can rise in the blood at different times. This makes it possible to distinguish whether the infection is acute or has been passed through. But be careful. During an acute illness, antibodies in the blood can be negative because the body needs several days to weeks to form them. So how's the disease treated? There's no specific therapy available to treat infectious mononucleosis. Antibiotics don't work against viral infections such as mono. Treatment mainly involves taking care of yourself, such as getting enough rest, eating a healthy diet and drinking plenty of fluids. You may take over-the-counter pain relievers to treat a fever or sore throat. A streptococcal infection sometimes goes along with the sore throat of mononucleosis. You may also develop a sinus infection or an infection of your tonsils. If so, you may need treatment with antibiotics for these accompanying bacterial infections. In rare cases, massive airway constriction may occur. In this case, treatment with corticosteroids is necessary. There is a risk of rash with some medications. Amoxicillin and other antibiotics, including those made from penicillin, aren't recommended for people with mononucleosis. In fact, some people with mononucleosis who take one of these drugs may develop a rash. The rash doesn't necessarily mean that they're allergic to the antibiotic. However, if needed, other antibiotics that are less likely to cause a rash are available to treat infections that may go along with mononucleosis. What lifestyle and home remedies are there? Drink plenty of water and fruit juices. Fluids help relieve a fever and sore throat and prevent dehydration. You may take an over-the-counter pain reliever. Use pain relievers such as acetaminophen and ibuprofen as needed. These medicines have no antiviral properties. Take them only to relieve pain or a fever. Use caution when giving aspirin to children or teenagers. Though aspirin is approved for use in children older than age 3, children and teenagers recovering from chickenpox or flu-like symptoms should never take aspirin. This is because aspirin has been linked to Reye's syndrome, a rare but potentially life-threatening condition in such children. In this rare complication, damage to the liver occurs, whereupon toxic metabolites accumulate and lead to brain dysfunction. You may gargle with salt water. Do this several times a day to relieve a sore throat. Mix 1/4 teaspoon of salt in 8 ounces of warm water. When will I be fit again? Most signs and symptoms of mononucleosis ease within a few weeks, but it may be 2 or 3 months before you feel completely normal. The more rest you get, the sooner you should recover. Returning to your usual schedule too soon can increase the risk of a relapse. In infectious mononucleosis, the spleen can become very swollen. The spleen, which is located in your left upper abdomen, is where the cells infected with the virus are broken down. To help you avoid the risk of rupturing your spleen, your doctor may suggest that you wait about 1 month before returning to vigorous activities, heavy lifting, roughhousing, or contact sports. Rupture of the spleen results in severe bleeding and is a medical emergency. Ask your doctor about when it's safe for you to resume your normal level of activity. Your doctor may recommend a gradual exercise program to help you rebuild your strength as you recover. So that's it for today. What do you think of our video? Let us know your thoughts in the comments below. If you enjoyed watching this video and would like to hear more from us, please subscribe to this channel and turn on notifications before you go. See you in the next video.